Alameda County, and an instrumental force in the creation and the authorization of PEPFAR.
Thank you. Thank you, Phil, first of all, and all of the staff at the Black AIDS Institute for your work in putting this press conference together, but also for your work in producing this very powerful and very important report. And I want to also thank you for continuing to raise the importance of the plight of the African American community in terms of the AIDS epidemic to the international arena at these international conferences. It's so important that the world understands that we are part of the global family. And I think this report today that we're discussing, you know, documents that, puts it in perspective, but your work and the Black AIDS Institute in building for this through these international AIDS conferences have been remarkable. So thank you very much. Let me also thank all of our panelists here for their leadership in combating this deadly disease. It's good to be with so many friends. They are out on the front lines each and every day. This is their life's work, and so it's an honor to be with all of you again today. As the only member of Congress, actually, who's been to each of the last 5 international AIDS conferences, ever since the Durban conference in 2000, let me just say it's important because for members of Congress to come to this, because these reports, what takes place at these conferences, are so important for Capitol Hill to understand. And so I've continually tried to educate my colleagues about the state of HIV and AIDS throughout the world, and also in the United States, particularly among the African American community and communities of color. So I'm pleased, as I said earlier, to see this report coming forward. It's very thought-provoking, and I'm definitely going to make sure that it receives the type of attention on Capitol Hill that it truly deserves. As the co-author, as Phil mentioned, of virtually every bipartisan global AIDS bill that has passed in Congress over the last 10 years, including the most recent legislation extending and expanding the President's emergency plan for AIDS relief, I am pleased by our progress in combating this disease globally abroad. However, our progress in combating this disease at home has not met with the same results. As the new numbers from the CDC show, AIDS is still running rampant in America, especially among African American women and young gay men in the African American community. I want to talk for a moment about PEPFAR and about why I believe that we need to have a domestic PEPFAR bill. The United States, as I said, should be proud of the tremendous accomplishments of the PEPFAR program. In a few years, PEPFAR has become the biggest provider of HIV/AIDS treatment and prevention services globally, and it has saved many, many lives. But PEPFAR is not a perfect program. While we have made many improvements in this bill, including, which I'm very pleased to report, we did remove and repeal the 33% abstinence until marriage earmark. We got rid of that in this PEPFAR. The President signed it. We did that. But there could be much more to do. There is much more to do, and much more we will do. But let's focus on what's been successful about PEPFAR, because it provides several important lessons for the HIV/AIDS response we need in our own country. First and foremost, PEPFAR brought together civil society, host governments, donors, and the private sector to support one single unified national AIDS strategy. Mind you, a national AIDS strategy to guide implementation of HIV/AIDS initiatives. PEPFAR brought considerable new resources to deliver health services, helping to build, which is very important, health infrastructure where few or no services are available. PEPFAR also brought a results-oriented approach with attention to careful monitoring of outcomes in the delivery of prevention and treatment services. At the highest level, PEPFAR sets overall targets for treatment and prevention delivery globally, and all partners, including the United States-based staff, are focused on saving lives and delivering measurable results. On the ground, PEPFAR promotes real partnerships between NGOs and governments, and it requires monitoring of service delivery and outcomes. These elements, significant resources, target setting, monitoring, and partnerships have brought an urgency to the PEPFAR effort that has been so critical to all that has been accomplished. So where is our PEPFAR for the United States? We need a domestic AIDS response that brings new resources to an effort that has been virtually flat funded for years. Now we need to double CDC's HIV prevention budget to at least, mind you, at least $1.3 billion and provide at least $610 million, which is still too low, I believe, for the Minority AIDS Initiative, which was established under the leadership of Congresswoman Maxine Waters in the Congressional Black Caucus, I believe it was 1999. And this initiative needs more money. I mean, even $600 million is too low for the Minority AIDS Initiative. And we have to expand funding for treatment services under the Ryan White CARE Act. We also need to rebuild our health infrastructure in communities around the country. And in America, we do need universal health care. That has got to be high on our agenda. Universal health care. We need a domestic AIDS response that is oriented around achieving clear and ambitious objectives in terms of reducing HIV infection rates, increasing access to care, and reducing racial and ethnic health disparities. And we need a response that builds stronger partnerships between communities and our public health service agencies. Most importantly, we need a national AIDS strategy that can coordinate a targeted national response to stop the spread of HIV and provide access to treatment for all of those infected. We need that, and we need that now. We need it now. For years, the United States has been a global leader in the response to the HIV/AIDS pandemic while neglecting our own serious AIDS epidemic at home. So now we must learn the lessons of our own global response and launch a better, resourced, evidence-based, and result-oriented effort to address AIDS at home. Finally, let me just say I was very pleased to hear President Clinton, who is such a great leader in the fight against HIV and AIDS. Here, he just said that he saw the report, he referenced this report, and he committed the President Bill Clinton Foundation to really begin to address this. And I tell you, I was so happy to hear him at this international conference put that on this agenda. And in my own county, we declared a state of emergency in Alameda County in Oakland, California, which has taken the lead in many, many respects on the whole testing initiative. So there are things taking place throughout our country that provide us hope, but we need this national strategy. So we must do better, we can do better, and we will do better. Thank you again, Bill, so much for this.
Thank you, Congresswoman Lee. Next we have